Hi, my name's Dr. Don Butler. Tonight what we're doing is we're taping a beginning class. This is basically for my current patients. I am not a professional speaker, and you'll find that out rather quickly. But this will also be on television. And so this might be a little controversy. Tonight when I speak, I'll speak from my heart, and I am here to help other people live a better lifestyle as a result of what chiropractic does. You may or may not agree with it. If you're already seeing a chiropractor or a medical doctor, you certainly can visit with them. But if you do have a chiropractic problem, I do urge you to speak with a chiropractor. It's not, I have many medical doctors and surgeons as friends and patients and nurses and other types of healthcare authority that I adjust here in this clinic. But I feel a lot of times you people out there take advice from people who maybe don't know what chiropractic can or can't do for you. A little bit about me so you know my credibility tonight. There are some people I'm speaking to in the audience, very small crowd tonight. But I have a Bachelor of Arts degree in physiology. It's a pre-med degree from the University of Minnesota. I was going to be an orthopedic surgeon, and the reason I got into chiropractic, I was in the military, I was an airborne ranger, and I fell in a very severe mountain climbing accident. Medical folks told me I was going to get spinal surgery. I went and sought other opinions, and I went to a chiropractor who had helped me. And that's when I decided I'd check out chiropractic. And after several months, I decided I got out of the medical school route after I graduated with honors from pre-med, and that's when I went into chiropractic. And then people need to understand chiropractic is an art. If you're a family member just listening to this tape because your spouse is coming in, I urge you to understand what's going on with your child as well, or your husband or whoever's in seeing our clinic, because they need support from you as a spouse. You don't need controversy going home because you're seeing a chiropractor. As you as a spouse, I think it's up to you to come in and understand what's wrong with your spouse and not give me a hard time, but understand and be compassionate towards your spouse. We're trying to help you and that spouse live a better life. And then the next statement I want to say, there's $4 billion a day spent in our country in health care. That's astronomical. HMOs, PPOs, it's a lot of medical prostitution going out there, in my opinion. And the bottom line is it all comes down to money. Like if we prevent a back surgery, I can pretty much guarantee you it will save you or the insurance company over $20,000. But you know, it's not even all about pain. What I want you to understand is wherever you're going to, let's get out of the pain, and then what are we doing to correct the subluxation or problem that's in there? And I'll explain subluxation in a few minutes. But what is wrong, and then what are we doing so you do not go back into severe pain or have a degenerative condition that should have been turned around 20, 30 years ago? What are we doing? Start thinking ahead, and let's start being proactive instead of reactive. Most people in their lives are reactive because the pain's killing them and they never did anything for years, and now they're here and we have a mess. Well, we can still help you get out of the mess, but let's not even get into a mess. And I think you need to learn from your history. Just like I feel history will come back to haunt you someday, whether it's Hitler and communism, or it's a bad disc in your lower back with leg pain. And if you wait for it to come back, there's pretty good odds that there's going to be serious problems down the road. Now, myself as a chiropractor, I teach doctors of chiropractic how to adjust people. I've been invited to speak at different chiropractic colleges. I do a lot of speaking on chiropractic, and I'm an advocate for the children being adjusted or checked. That doesn't mean they have to get audibly clicked. They may be very gentle maneuvers like you do on infants. But chiropractic can help the children. As we say in our clinic here, is as the twig is bent, so grows a tree. And the problem is when I have people, like there's a 60-degree scoliosis over here, 64-degree scoliosis on a 41-year-old female that changed into a 54-degree scoliosis. It decreased 9 degrees in a matter of 3 months. She hasn't strengthened it, it's just been all from chiropractic adjustments. There will be a time in the next 6 months where she has to strengthen and start taking things over, but you don't want to strengthen something so crooked until we start to change it. Does that make sense? Now, if you have children, I tell everybody, just do a self-check on your children. Don't be adjusting them, but you can look at your children, and if you have kids and your kids aren't getting checked, I'm disappointed in you. Because do you want your children to grow up with the same mess that you have? I don't think so. And the reason people don't do it is a thing called money. And if you're going to another chiropractor or where other health profession, make sure you can get that finance is taken care of. But you need to understand one principle. There isn't something for nothing, and there has to be an exchange. Okay? Doesn't mean we can't bend and try to help you as much as we can, but there has to be an exchange, because you don't get something for nothing. Okay? And if I give you freebies and free care and stuff, I bet you don't ever correct. I've noticed that hundreds of times. Now, when you look at the children, check their foot and see if there's a foot rotated in or foot rotated out. Or check their pelvis and see if there's instability, if one hip is higher than the other. Their shoulders, how are they holding their head? Even have them bend over and you look for a hump in their middle back. That's a juvenile scoliosis that's taking place. They need to be checked by a chiropractor. They don't need to be, in my opinion, this is all my opinion tonight. I might be wrong. I've been wrong before, but I've helped hundreds of people prevent surgery, from carpal tunnel syndrome to knee surgeries. I had a knee surgeon in town here in Missoula, Montana. I tell one of my patients that I couldn't help him. 2 weeks their knee was out of pain. He said it was a fluke. Okay, and he's a good man. He just doesn't understand what we do chiropractically with knees. I've had numerous people tell people that they shouldn't be adjusted. Well, check with a professional or a chiropractor before you know you can or cannot be adjusted with whatever is wrong with you. I have a little girl named Amanda who's supposed to get rods put in her knees. She has a crooked knee, and we're starting to adjust her knee very gently. And then we're starting to go through a strengthening process, and her knee is about 40 to 60% corrected right now. And I feel there's a strong chance that this girl will not need to have a rod put in her leg. That's pretty neat. You start to heal. You tell other people about chiropractic, because there's hundreds, if not thousands, of people out there that suffer needlessly. They're on needless medication, in my opinion. And if you're going to a chiropractor and you're not getting results, get another chiropractor's opinion. If you don't heal with me, get another opinion. It's okay. But first of all, get your children checked. Everybody's children should be checked. That doesn't mean x-rayed, but checked. Okay? In our country, there are approximately 250 million people. I might be off on some of the statistics, but I believe I'm fairly close on every one of them. I've just read it from articles and things. I don't have the article with me, so I'm sorry. About 250 million people. Different statistics show 9 out of 10 people have back problems sooner or later in their life. Then statistics say that 1 out of 3 people might have a herniated disc sometime in their life. So that means 75 million people will have a disc disorder sometime in their life. Then, out of that 75 million people, about 5 million of these people are partially disabled and 2 million are completely disabled. I strongly feel, this is my opinion, that I feel somewhere between 50 and 80% of these disabilities never had to be disabled if they would have been taken care of properly. And the problem is when you have insurance and other factors involved in your care, when somebody behind a desk who has never even talked to you, or another doctor says you shouldn't go to another chiropractor, not having any more adjustments because you've had 8, you might need 28 adjustments. I don't know, but you might need a lot more care than what that person behind a desk who's just going by some guidelines states. So that's why I say, if you're in my clinic, we will do what it takes to help get you better. Okay, that is the biggest problem why people go into long-term problems, in my opinion, if they're insurance. But don't let yourself get into that category. Like right now, you are already in that category where you're partially disabled, basically, and you've been in pain for years. And there has to be a point in your life where you draw a line behind and say, I'm not going to live with this anymore. Okay, we're going to take care of it. And it might take you a year or 2 to get healthy. It won't be a month or 2. It might be a year or 2. But we just need to see a gradual, slow but sure better along this year or 2 journey. Okay? That doesn't mean you're coming 3 or 4 times a week for a year or 2, but at first couple months, me and you will be buddies. And then we can start to back off and start some strengthening programs. That makes sense? What I try to focus on in healthcare is a lot on prevention. Let's do things now to prevent serious things later. like your serious hip pain right now. This young lady could hardly walk, okay, about 5 days ago. And you need to learn from that, because something's wrong because that severe pain in your spine. And we're fixing a rotated pelvis so that problem doesn't turn into a scoliosis like her mother's. Now, we're going to go through a few things and we'll be done here within the hour. Is the biggest thing when you're getting adjusted is you have to watch how you bend over. When you pick up things, I just need you to bend at your knees and keep your back as straight as possible. A good example of that, if I'm lifting a 10-pound box properly, is 10 pounds of pressure on my spine. Whether I have a scoliosis, a herniated disc, facet syndrome, whatever. Now, as soon as you bend over, lifting the same weight, that puts 100 pounds of pressure on that disc. Right into here, this disc space. Now, if you bend and twist with the 10 pounds, it puts up to 500 pounds of pressure in the disc space. That's why that's such an important biomechanical principle right now. And you have to be careful with that with your neck as well. After I adjust your neck, or check your neck, don't bend and twist. Leave it alone, it'll feel better. And if it doesn't feel better, that's why I love to adjust people in the mornings. If it doesn't feel better, come back the same day. We will not charge you again that day. Come back. We'll check it. Because we can make mistakes and we need to understand what's wrong. And sometimes I'll have to check you twice in one day. Now, I feel it's imperative that children get checked as well, like I said. And the reason why is when you look at the spine, we look at two different curves. The first curve is we look for and measure scoliosis like that gal's up on our view box over there. And you don't want scoliosis. But then do not tell yourself at whatever age you are that scoliosis cannot change. I've seen hundreds of people's spines change. I just had a 65-year-old lady's spines change. Her scoliosis decreased about 40%. They can change, but that's a controversial subject. But do not, if you ever get an opinion where you're going to be in a permanent problem, get another opinion. Doesn't mean they're right or wrong, but get other opinions. Now, then, when you look at the side curves, you want 4 curves to your spine looking at it from the side. You want a neck curve, a middle back curve, a lower back curve, and a sacral curve. These are extremely important, and this is where we find a lot of people degenerate needlessly, in our opinions, chiropractically. Like when you have a reverse neck curve, you get what we call a subluxation, or that just means a pressure within the joint space. And that subluxation, if the pressure's there long enough, it puts pressure onto the nerve root, which causes you a pain. Do you know that the average person has a subluxation or nerve pressure about 8 years before they even feel a symptom? Do you know that the average headaches person spends about $8,000 on drugs through their life? But you know how that goes. And you know the average child that we help with headaches usually only takes me 2 or 3 weeks to clear out the problem. And sure, they might need to be checked once in a while, but cost comparatively is a big difference. Now, then, if you are degenerated or worn out, my question is, can this reverse neck change? Then if the curve changes, my question with you is, can the degeneration be slowed down? Then at the advanced class, we'll talk about something called regeneration, where there's new tissue growth. It's unbelievable. Give your body, I don't care whatever age you are, whatever you have wrong, the ability to heal better than what it's doing now anyway. Does that make sense? And tonight you need to understand a little bit from me what's wrong with you. And you have to develop a trust with your physician, whoever he is. Like I know you trust me, I've adjusted you for a long time now. And you have to develop a trust. I have people brought to me in ambulances. I just adjusted a person with a very serious condition. They didn't want to go to an orthopedic surgeon, but I made them go just to get another opinion today. And it's okay to get those opinions. I may or may not agree, but sometimes I feel you need other opinions as well. So I feel in my heart we're doing everything we can for you as a patient. Does that make sense? Now, the few principles that we'll go over tonight, motion is life, and I need to help coach you. Look at me as a coach to you, as a friend. and I'm to help guide you onto a better way to live. Okay? That's it. Now, the first one, if you're doing a lot of standing during the day, just like if you're a teacher, put your foot up on the podium or on a box or whatever, and just every 5 or 10 minutes, just shift. Okay, go from one foot to the next. Now, if you do a lot of sitting, you're going to aggravate your condition, especially if you're flexed too far forward, because that will increase the nerve pressure wherever the subluxated or weak area is. Now, with computers, since there's so many people that have computers, the basic thing with your chairs on computers, you want your thighs parallel with the ground, your arms parallel with the ground when you're on the keyboard. And your monitor shouldn't be off to your right or left, it should be straight in front of you. And put that monitor about 6 to 8 inches up in the air, and then rotate the monitor up about 10 degrees, and it'll take a lot of pressure off your spine. Very important. Then if you have things like carpal tunnel syndrome or other wrist problems, make sure you let me know so I can check those to make sure there's nothing serious developing where you need an orthopedic surgeon, for instance. You know, anytime you sit, you put 4 times the pressure on your spine. So if you have a bad disc like you have, Melody, yes, every time you sit, you put 4 times the pressure, and that's why it burns so bad down there. Just sitting perfectly, you put 4 times the pressure on your spine. When you slouch, you double the pressure to about 8-fold. Does that make sense? So watch how you're sitting. And you'll know naturally, as we start to adjust and change your structure, your posture will naturally get better, and we have pamphlets for you on posture. Just read them and just follow the rules. It's not that hard, and people make it way too hard. But quit blaming your posture for all your problems. There's usually a subluxation or a misaligned spine that's causing many thousands of people to appear crooked, where they're trying to stand up straight and they can't. Now, since you sleep about 1/3 of your life, I feel it's fairly important to speak about sleeping for a few minutes, you suppose? Now, if your mattress is over 10 years old, talk to me. If you're on a waterbed, talk to me. I'm not against those things, but just speak to me so I understand what you're sleeping on. Now, if you're sleeping on your stomach, we'll have to change that habit and identify yourself, and I'll give you some helpful techniques that'll help you change within about 3 or 4 weeks. Now, the best thing to do is sleep on your side or on your back. Now, if you're sleeping on your side, I want you to put a pillow in between your knees, and the reason you do that, folks, is it takes about 20 to 30% of the pressure off the spinal cord or the nerves that come off the spinal cord, and you'll do better. Now, if you don't do better, just kick the pillow out. Now, if you're on your back, put a pillow underneath your knees, which will also ease the pressure off of the nervous system in your spine. This is very important, like for both of you young ladies right now. Now, if you're laying on your back reading every night with a couple pillows like this, I can guarantee you're going to irritate your neck and your middle back, and you will slow down, if not stop, the correction of your reverse neck curve. That's where your neck's going backwards. Okay? Now, after about a month or 2 of care, you'll want to purchase a cervical pillow, and that pillow will help influence that neck curve. Oftentimes, though, a cervical pillow is given to a patient too early, where it'll irritate you because you're not ready for it. So just identify yourself for that. Now, with your lower back, I don't want you to be crossing your legs at all. And the reason that is when we're adjusting your pelvis or your lower back for a disc condition or whatever, is when you're crossing your legs, that rotates the pelvis, and that usually will irritate what's wrong with your lower back. If it feels good to cross your legs when you have a bad lower back, just identify yourself to the chiropractor, and he'll adjust your hip correctly, which will take that problem away. Does that make sense? Wallet. If you have a wallet in your back pocket for the men, that wallet should not be there. And my wallet's sitting right here. Now, what you need to be doing, the reason that is because just a 1/2-inch wallet can rotate that or make a 3 to 5 degree curve in your spine. So that wallet should not be there. This is imperative. And I even play with you guys, and if I catch you with a wallet, you owe me a quarter. Because men are kind of stubborn. Women just will do it. Men, they're kind of stubborn, but as soon as you mention a quarter, they'll usually take it out. Isn't that kind of funny? Exercise is imperative for everybody. And I look at life as a training. And you will need to get exercise in your life. But right now, how we start off initially with you is stretches. If you are exercising, I'm not telling you you have to stop, but let me know what you're doing, and then we'll work on you accordingly. And some exercises will need to be changed with you at first. Does that make sense? I feel stretching is imperative for anybody. I feel people strengthen their spines too quickly. I feel you need to go through a stretching program and an adjusting period, and as your spine changes, which it will, almost always, then you start to strengthen what's changing. But if you try to strengthen what's really bad in there, you'll usually irritate and slow down your healing process. Does that make sense? Now for stretching, I'm just going to give you some basic stretches, and there's a few more stretches in our pamphlets that you can follow by. They're very easy to do. And the first one is when you're sitting. I'd like you to bend over about every 20 or 30 minutes, or when you feel that pressure building up in your lower back, just bend over for a second or two, and then pull one knee up, and then the other knee up. And then about twice during your workday, I want you to do a calf stretch where you just lean over a table or a chair and then push your back up for about 20 seconds. And then let your stomach down about 20 seconds. Okay? This will help the area that we're taking the pressure off of, the spinal cord or the nerve root. Every night before you go to sleep, I would like you to lay on your back and pull one knee up for a minute, the other knee up for 1 minute, and then pull both knees up for the third minute. Somebody like Melody, where you have the extreme low back pain with radiating pain down to both legs, isn't it? Is you should be doing this about 4 or 5 times a day. If you have a lot of leg pain or a lot of severe low back pain, you should be doing this 4 or 5 times a day. And be very careful of any twisting. Then before you go to bed, I want you on all fours. This is called a pelvic tilt. Push your back up in the air for 20 seconds. And then let your stomach down for about 20 seconds. But you have to be careful, because if your disc is irritated, or if you have a bad low back with Facet syndrome, is that can irritate your lower back as well. Don't worry, usually after about 2 weeks of adjustments and some ice, you'll be able to do this quite easily. Then before you go to bed, I'd like you to lay on your back with your feet up there and push your lumbar spine back into the floor. Like if this was the floor, which it's not, you would just be squishing your low back into the floor like this, about 10 or 15 times. Does that make sense? It's very important, I feel. Before you get out of bed in the morning, put your hands over your head and stretch for about 20 seconds. The reason you do that is that takes a lot of pressure off the intervertebral joint in your spine. Now when you have a subluxation or pressure, now subluxation is a general term, that might be a scoliosis, it might be a worn out spine. Regardless, there's irritation on the nerve roots coming off the spinal cord. That's what the subluxation is. And one of the reasons I want you to stretch is because that helps take more pressure off. I'm not a real traction fan in most instances. Sometimes if they have a fractured neck or something, I'll suggest traction, but most of the time I don't suggest traction. But I like this self-traction like that because that helps the joint space. It's actually very important. Now, I usually tell you people this too, is if you wake up in the morning like with headaches, the problem is usually somewhere in your middle back, like Melody's. Now, if the headaches come on during the day, you usually find the source of your headaches, if it's nervous system related, up around your atlas or underneath your ears or your occiput region. That's when people think they have stress headaches and they think they have to live with them. That's not a true statement, I feel, most of the time. Now, if you have headaches during that time of the month, for females, have your chiropractor check your lower back. Get things checked. I can't tell you everybody should at least get checked. And I can't check everybody. Now I find the most important thing about my relationship with you as a patient is me teaching you what I do and how you're supposed to heal. I feel it's imperative as you start to get adjusted that you can picture what's supposed to happen physiologically in your body. Because whatever the mind can conceive, we can achieve the healing a lot better, can't we? So I want you to start picturing what's supposed to happen, and I'll show you how to do that in a few minutes. Because if you don't start picturing what's supposed to happen, you're not going to get any results usually, or it'll take a lot longer to get them. I have a physiology degree. I enjoy this statement. Your heart beats over 100,000 times a day. Your blood travels over 168 million miles a day. You speak over 40,000 words a day unless you're an attorney. And you exercise 7 million brain cells. I studied it for about a year on the brain and brainstem last year. You know you have 18 billion cells, and out of those 18 billion cells, there's dendrites that make connections between the cells, and there's 31 trillion connections from the best they can figure out. It's unbelievable. Now, like when you picture things, like if you studied what professional athletes and Olympians do, is when you picture anything, or when you're looking at me right now, you have an electrochemical response in your brain where through imaging electrochemically, there's a pattern created. Okay? And what we want to do is subconsciously help you focus on what's supposed to happen within your body, whether it's a crooked back or whatever, to change, and you start picturing the change that you want to occur. And I can't explain it, and psychocybernetics does a fairly good job at explaining it, but their change, it'll promote the change quicker. Okay, and there's a lot of controversy over that statement, but believe me, it's true. It is really true. Your body has the ability to function and keep you well, provided it's not interfered with. You should be thankful you have all this pain. Your body's screaming at you that something's wrong and saying, fix me. Or are you just pumping more ibuprofen and all these drugs down you, you don't even know what's wrong? And I'm not against drugs if you need it, because sometimes I feel you do need drugs and sometimes I feel you don't need drugs. And I'm not here to take you off drugs because I can't, medical legally. That's you and your MD talk about that. But I'm here to make a change with your body, and sometimes you can change your drug patterns tremendously. See, when I look at a subluxation, there's just some kind of pressure, and it's like a finger with a rubber band wrapped around it. And you might rub it on, it might feel a little bit better, you might move that finger around, but what you have to do is take that rubber band off that finger. And that's what I feel proper chiropractic does, is releases that pressure off the nerve root or spinal cord, and that helps that healing within. It's unbelievable. And I feel, this is controversial too, but in my opinion, your body has an innate intelligence. And I'm not the only chiropractor who says this. Hundreds of thousands of chiropractors speak this. Some don't. But your body has a survival mechanism, and it's talking to you. What are you doing to change it? And then if you can tap into the innate, or tap into your own body's healing, is how I feel that is focus on what the problem is and focus on you feeling better, and that's your body innately healing itself. Your body heals itself. The doctor doesn't heal you. Sorry, I don't feel that to be true. I feel your body heals itself, and I'm a partner in that relationship with you. And I feel that to be true with any physician. So we're going to start the picturing process. Now, this is my opinion too, but I've studied people from Bernie Siegel, who's a very famous oncologist, cancer doctor, many different people on healing. And I feel this to be very, very true. I feel there's 3 circles to healing. You have a physical body, and I might tell you you have a disc problem or structural problem or whatever, something wrong. And if you ever don't feel right with what I tell you, it's okay to get other opinions. I will not be insulted at all. And if you ever go to a doctor and they tell you not to get another opinion, well, I think you maybe should anyway, because something's usually wrong. Maybe that doctor has a bad ego problem and he thinks he can do everything. Well, the number 1 rule is not everybody gets better with me in this clinic. And the number 2 rule is sometimes I need help. Now, the second circle is, I feel, is mental, and I'll combine emotional. This could be 2 circles. And the third circle is spiritual. Very controversial seeing a physician on tape telling you, or on TV, telling you about spiritual. I feel, it's my opinion, I pray every day before I come in here for guidance from a higher power to help people heal and live a better life. I feel you as a patient, if you don't buy this, it's okay. Don't even worry about it. But I feel you need to pray for guidance and wisdom from me as your doctor, or whoever your doctors are. Okay? And if you don't feel innately right with whatever the physician's telling you, get other opinions and tell me. But I feel these 3 circles work together, people. I know they do. And then every one of you have a thing called stress in your life. Everybody does. Now, stress, I feel, it will irritate your structural problem or slow down your healing a little bit. Understand that. But what are you doing to control the stress is my question. And now I'm not a psychologist. Maybe you need a psychologist or a pastor too, I don't know. Most people do. Need pastors anyway. Now, with stress, can that irritate you mentally? And when your mind gets irritated, can you get irritated emotionally? And the problem with most of your pain out there is you've had the problem so long, or you're so frustrated with it, you're in too much emotion, and you can't make logical decisions, especially with your healthcare practitioner. And it's my job to bring you over into a logical viewpoint to, first of all, understand what's wrong, and then a thing called time into the equation of your healing, and what's it going to take to help you. Then after you get out of the pain, I wonder if your condition is correctable. Think differently. Think on higher levels than you ever have in your life. Expect to heal. Pray for your healing. And let's get some changes. But when you're so off balance emotionally and mentally, that will slow this healing circle off as well. And I feel a lot of people, especially with chronic pain, you're so off balance in different areas, is we just got to get back on track a little bit. Okay? And don't worry, through our whole life, we'll always be working on getting back on track. Even Dr. Don, dancing chiropractor, gets off track. And I'm always working to get back on track with my insides. I was just on a mountaintop today praying and focusing on what I want in my life and where we're going. But we have to take time and focus on where we're going in our life. And you need to take time with your healing right now and focus where you're going. Now, I feel that's imperative to do. Then some people have had terrible histories where I feel this is overlooked. Some people have been raped, physically abused, sexually abused, mentally abused by your spouse. And I'm sorry. But a lot of times when you've had so much mental trauma too, I find that those people take longer to heal as well. So understand that and quit beating yourself up and just get on the journey, because healing is a journey just like life is a journey, and you have to get going somewhere in your life on this journey. And you can write me in or out of that equation anytime in your journey. And how I look at it is your life is like an autobiography and you're the author. And I am just one of the characters in your life right now. And you can write me in or out or have other people in or out of there as you want. But what I'm concerned about is the end chapter of your life, that you're doing much better than you would have done if nobody was helping you. Does that make sense? You need some coaches and you need some help sometimes. Now, as I look at visualization with healing, is basically I'll go all the way back to the embryonic form, where two cells come together and form one cell in that little embryo. Okay? Within about 13 days, you have about 16 cells, and this is going to be an exaggeration of how big it is. But that cell cluster is called a morula. It's about 16 cells. And then you have a little primitive streak that develops down the middle. And then, after that happens, you have 31 little slivers that come off of that primitive streak, which is basically your nervous system. 31 nerves come off your spinal cord. How do your end organs form? From dermatome and sclerotome patterns, check your embryology, and they start to branch off. Like the heart starts to beat at 21 days, and the stomach's formed, the liver's formed, you know, I'm not a very good artist, the kidneys, every muscle that you have in your body is formed from those dermatome and sclerotome patterns. Every little sinus cell, every thyroid cell, la-di-da-di, everybody's formed that way. Now, my question to you is if you have pressure around the brainstem or the nerve root, can you get end organ dysfunction? Can you get a problem inside of your body from pressure on one of those places? And the answer is absolutely, positively yes. Let me use a basic example. Let's say you have heartburn, and you need to trace the nervous system for you skeptics out there. And the nerves with most heartburn people come out of the middle back. And there's too much acid being secreted into their cells. And you keep blaming stress on this stupid heartburn problem, and let's focus on the cause of it, which is usually back there, and physiologically there's just too much acid, and then your life is usually off balance, and you need to get balance in your life. And I wonder if a healing can take place, you heartburn people, or if you have sinus headaches periodically, or if you have a thyroid problem with thyroid imbalance in your body, metabolism's messed up. Let's take something so easy as a muscle spasm. Usually nerve root pressure can cause the muscles to get irritated and they spasm more. There's more muscular activity as a result of the nerve root being irritated. And the problem with many people, the nerve root's been irritated for many years and you're expecting something to go away in 2 treatments, which it won't. It's a journey and it's going to take several months for you to start to feel better with this. Take the pressure off the nerve root and the muscular system will do better. Even different parts of your body will do better. You'll notice you start to sleep better at night. You might notice you can start to focus better. You might start to notice that your anxiety and your panic attacks start to decrease. I'm not saying they will. You might notice your child who has ADHD isn't so hyperactive. I saw 6 children come off Ritalin last year. And you know, part of the deal with that is I just told them they didn't need to be on it. Now, I'm not saying all kids need to be or shouldn't be on Ritalin. I'm not saying that. Don't read into the statement. But get other alternatives checked out with your children. And the biggest deal with most children is you need to love them more. But anyway, start understanding what's going on with your body. And let's go over some visualization. Whether you have sciatic neuritis or leg pain, I want you to picture where the leg pain is, and then picture where my hand is as I'm starting to set up and adjust you. I don't say manipulate, I say adjust you. And after I adjust the pressure off that nerve root where the sciatic nerve originates, I want you to feel or visualize the pressure releasing down your leg. Now the problem with most people is you want that hip pain gone yesterday. And you want that pain to go right after I adjust you. And sometimes it will, but most of the time it will take you a few weeks before you start to actually feel that pain leave your leg. And that will happen, almost always. Or you feel that pressure in your stomach getting better. Or you feel those migraine headaches decreasing. Or the sinus headaches. Or whatever the problem is. You got to picture what's supposed to happen. As you look at the nervous system, it's massive. You have those 31 nerves that come off your spinal cord, and these nerve roots split and divide thousands of times. This is very confusing figuring patients' problems out. There can be many different problems. Okay? So I might be up at your atlas, way up underneath your ear for something that's wrong with your stomach. Okay? And give me 2 or 3 weeks to figure out what the problem is, if it is from your nervous system, and where the subluxation actually is, because I'm not always right. We might have to figure it out. Now, I feel the most misunderstood thing is what's happening when you get audible clicks to your spine. All the clicks is a release of facet joint space right here. See, there's a pressure that builds up in the facet joint space. This is the vertebral body, and this is the back part of the bone called the spinous process. As you develop a subluxated area, there's a pressure that builds up, and as I adjust the bone, you feel a release in the facet joint space, and that's all the click is. And the problem at first is I usually need to know you quite a bit the first 2 or 3 weeks to reduce the pressure. It's not the facet joint space, always. Sometimes it is. Because the facets can cause you pain as well. But so can the disc and the disc herniation onto the nerve root. So that's all the clicks are. And can you click yourself? I just had a little old man tell me that he could click himself, and he made himself much worse, actually. And he didn't want an x-ray. And I told him, if you want me to do adjustment, I need an x-ray so I know what's wrong in there. So, and not everybody gets an x-ray, but this little old man will if I'm going to touch him, because I know he's worn out. And a lot of times we need an x-ray so we understand what's wrong. Because you can have a pain in your middle back that's caused from a curve in your lower back. You have to understand where the source or the subluxated problem is. Does that make sense? Wow, and it's quite confusing. But now let's talk about the disc a little bit, because I feel a disc is a very controversial subject. Like this lady has a severe disc problem in her lower back. Now, the disc is very basically made of tough annular fibers that intertwine around the nucleus of a disc. The nucleus of a disc, a good picturing, is like a bowl of Jell-O surrounded by saran wrap. And the nucleus of the disc would be about right here. Now, when we make a proper adjustment to a person, and this is the art of chiropractic, because if a chiropractor hasn't helped you, it doesn't mean a chiropractor won't. So maybe try another chiropractor or two, or you basically hear who's good around your community. That's how I built my whole practice from referral. Okay? But when we do is we adjust the bone over the nucleus of the disc, and if a spine can change, if it's not a congenital abnormality, and even if it is something, a bone that's naturally crooked in the body, we can often help that person feel better. But we might not be able to correct the person's spine. Now, a lot of the times, the nucleus of the disc shifts right or left or backwards. Like if it shifts backwards and it's your neck, it'll make the whole neck appear in a reversed formation. And you might have arm numbness, which is not normal. Okay? And we set the bone over the nucleus of the disc, and through repetition and time and strengthening at a certain level, we can change the appearance of the reverse neck curve, or scoliosis, like this 64-degree scoliosis changed to 55 degrees. And so don't tell yourself it cannot change no matter what age you are. But there's a lot of variables in if you can or cannot change. And nobody knows always. And sometimes we have to see a thing called time, and time will tell. The first thing to do with me or any physician is let's get you out of pain. And then after you're out of pain, if you understand what's wrong with you, what are you doing to correct the problem or stabilize the problem? And then what are we doing after you stabilize or correct the problem for long-term performance care? I feel that's critical to understand. Now, a normal disc is about this big in relationship to this thin one. And through the course of years, what happens with most people is they never take care of themselves properly, and they've had the problem for many, many years, and that subluxation or the misalignment will cause that disc to wear down. This is controversial as well. It's okay if you disagree, even if there's a surgeon sitting out there, because this is very controversial. Now, a lot of times when you have a subluxation or the nucleus shifting over, I wonder if that can cause the nucleus to shift through the annular fibers and cause what's called a herniated disc. And that disc herniation, and even chiropractors treat this differently, but how I observe this, and this is my opinion, is it bulges onto the nerve root. Like if you have leg pain like this lady does, it bulges out onto the nerve root, and there's a pressure that's produced, or sciatica, down your leg. Now, if it's down both legs, a lot of the times that disc is bulging right in the back part of the spinal cord, which irritates both nerves that come off both parts of the spinal cord, and that's why both legs can go numb or radiating pain or whatever, hip pain, whatever it is. Now, what we do is the art of chiropractic is to adjust the bone over the nucleus of the disc, and here's where people say, well, you can't fix a herniated disc. Well, we just had a lady named Lori who had a herniated 5th and 6th cervical disc. 7 months chiropractic, and she had an MRI before, and she had an MRI after, and chiropractic was the only thing that she did, followed up by an orthopedic surgeon. And we found that the MRI, that it was 80% reduced on her MRI scan, pre and post proof of what chiropractic does. And you know the sad thing is that the workers' compensation paid for all the medical stuff, but it didn't pay my bill. Okay? Who loses? The patient if I can't figure out a way to take care of Lori, but we figured out a way that we could help her. She still gets care here, current patient. But don't tell yourself a herniated disc can't change. Now, do they always change? No. Okay? And the problem is you take advice from, it's like taking financial advice from a dishwasher. And you listen to your neighbors or your spouse more than you do to a chiropractor. And I'm not here to cause a disruption in your relationships, but let's listen to some truth and start watching who you take your advice from. And the medical doctor isn't wrong, but the medical doctor sure can call me and I can call him, and we can work together as a team. It's much better than it was 10 years ago even. And we can work together for you people, but start getting chiropractic opinions. We just happen to turn into the second largest healthcare system. Okay? It's massive on what's going on in chiropractic. Now the problem is, as I said, if you're taken care of properly through your life, I feel the chances of you wearing out or degenerating is much less. Okay, can I prove that? No. Can I guarantee it? No. I just feel in my heart and soul that your chances of wearing out are a lot less. The first thing is, let's just get you out of this pain, and then what are we doing for your future? And then understand what the subluxation is. The subluxation is just basically a fixation, a joint that is stuck and unable to properly move. And what we do is we put the joints into its proper motion. But folks, it wouldn't take me 8 years of education And years of adjusting people. I've adjusted well over 5,000 people, okay? And it wouldn't take me years to tell you to click your spine and do this and twist it around. You're going to hurt yourself sooner or later. And can a chiropractor hurt you? Sure he can. Does he mean to hurt you? No. And usually, can he cause serious stuff? Well, they can, but most of the time they won't. But you have to understand what's wrong, and that's the chiropractor's responsibility to take care of you. Now, but understand what that subluxation is. And that's in basic terms. We treat the person as a whole. We treat the cause of the problem. And I'm not a symptom doctor. Let's get the symptoms gone and let's help the body heal itself. You've been in pain too long and you have to make it, you're at a crossroads right now, and you either have to take one road or the other road. And if I'm on this road, let's get to a correction road and square you away. And then I want my patients to stand for something. Because the medical folks and other patients will not listen to me, but they'll listen to people that we've helped. I just had this person that had 20 years of migraines. And she hasn't had a migraine now, and she had them about every day of her life. She hasn't had a migraine now in 3 months. Okay? People change. You can change. And then as you get better, I expect my patients to tell other people about chiropractic. Tell your medical doctor you're going. Don't be afraid. They're not going to bite you. Okay? And then have the courage to stand up and tell somebody they should get chiropractically checked if they're how many more drugs they need to buy. How many more years of pain do you need to live in? Why even have the problem? Get your children checked. Find somebody in your community who you can trust. And I'm going to end up our class with this. There was a little boy named Justin Humphrey. He's still alive, but his heart monitor would go off every night. Okay? And the reason I even check infants is because my little boy died and they wouldn't let a chiropractor into the hospital, St. Children's Hospital. I don't know if he could have been helped, but why not even check? The emergency room doctor or the pediatric ICU doctor was such a jerk he wouldn't even let him in. Okay? And I was so emotionally devastated, I just went through it, and my boy died in my arms a week later from brainstem pressure, cerebral swelling. Fell and hit his head. 24 hours later, he was in a coma. It's sad. Could he have been helped? I don't know. But I always promised myself, I don't understand the reasons why I go through things in my life, but I knew I was supposed to learn from that, because my little boy is always with me. Now let me tell you a little about another little boy named Justin, as I was talking about. Justin's heart monitor was going off every night. I set this little boy's atlas one time way up here, and I don't click babies or children, but just moved it just very gently, and the little boy's monitor didn't go off again. And there was 2 pediatric folks in town that told him he shouldn't be brought to our clinic. I'm glad he was brought to our clinic. And then one of them said we ripped them off. I wanted to know how much we charged him. Well, this boy, and this can get me in trouble for saying this on tape, but this boy didn't have any money. What am I going to do? Send him into collections and get nothing anyway? So I didn't charge him. I wonder what that adjustment was worth. $25? $100,000? $1 million? Well, that's really besides the point, people. The point is you got a result. And that's what we're here for. And we want your results, and we want your results. And you can get them, but start thinking differently and be willing to change. Thank you very much.